Hello everyone, and welcome to the Animation Therapist channel. I'm glad you're there watching. I have no doubt that you will find this episode helpful and educative. I will like you to watch to the end, because I have lots of beneficial information to share in this video. In this video, we will be exploring what you should know about the borderline personality disorder. We will describe what personality is, and also define personality disorders. We will highlight the different personality disorders, and also discuss briefly the mode of treatment. Let's start by defining what personality is. I know you have heard different meaning of what personality is, which may be right or wrong. But personality in simple terms, can be defined as the way of thinking, feeling and behaving that makes a person different from other people. It entails the uniqueness of an individual in terms of how they behave, think and feel. An individual's personality is influenced by experiences, environment, which include surroundings, life situations, and inherited characteristics. A person's personality typically stays the same over time, whereas personality disorder, according to the American Psychiatric Association, are long-term patterns of behavior and inner experiences that differ significantly from what is expected. They affect at least two of these areas: 1. The way of thinking about oneself and others. 2. The way of responding emotionally. 3. The way of relating to other people. 4. Way of controlling one's behavior. Before an individual's maladaptive patterns can be classified as a personality disorder, one's way of thinking, feeling and behaving must have deviated from the expectations of the culture, causes distress or problems functioning, and lasts over time. The pattern of experience and behavior usually begins by late adolescence or early adulthood and causes distress or problems in functioning. If adequate treatment is not provided, personality disorders can be long-lasting. There are different forms of personality disorder, but the common types include 1. Paranoid personality disorder, which is mainly characterized by suspicions and distrustful behavior. 2. Schizoid personality disorder, mainly characterized by detachment and being withdrawn. 3. Schizotypal personality disorder, commonly associated with eccentric and disorganized features. 4. Antisocial personality disorder, majorly with features of being impulsive and irresponsible. 5. Borderline personality disorder, usually characterized by instability and emotional dysregulation. 6. Histrionic personality disorder, a majorly dramatic and attention-seeking. 7. Narcissistic personality disorder, majorly exhibit grandiosity and self-centeredness. 8. Avoidant personality disorder, usually fearful and socially anxious. 9. Dependent personality disorder, usually excessively submissive, conforming, and clingy. 10. Obsessive compulsive personality disorder, usually perfectionistic and rigid. In this first episode, our focus will be on borderline personality disorder. A borderline personality disorder is a serious mental illness that centers on the inability to manage emotion effectively. While some persons with borderline personality disorder are high-functioning in certain settings, their private lives may be in turmoil. Most people who have borderline personality disorder suffer from problems regulating their emotions and thoughts, impulsive and sometimes reckless behavior, and unstable relationships. It is characterized by extreme levels of emotional instability and behavior, affecting all interpersonal relationships of the sufferer. Persons with borderline personality disorder may experience intense episodes of anger, depression, and anxiety that may last from only a few hours to days. These experiences often result in intense mood swings, impulsive actions and unstable relationships, which is associated with frequent breakups and intense argument. Impulsive actions are basically the behaviors or decisions made without fully thinking through the consequences or considering alternative options. These individuals often act on instinct, without taking the time to reflect or consider the potential outcomes of their actions. They may experience extreme mood swings and can display uncertainty about who they are. As a result, their interests and values can change rapidly. Some of the possible cause of borderline personality disorder can be a mixture of genetic, environmental, social, and biological factors. No singular factor can be attributed as the cause, it's usually a combination of these different factors. Borderline personality is about 5 times more likely to occur if a person has a close family member with the disorder. But that doesn't mean having a family with borderline personality disorder will automatically make you have the same disorder. What it means that it increase your risk of having the disorder. Signs you may have borderline personality disorder may include inappropriate or extreme emotional reactions, extreme mood swings, distorted self-image, highly impulsive behaviors, a pattern of unstable and unsuccessful relationships, an experience of paranoid thinking, a chronic feeling of being isolated or empty, chronic self-harming behavior, multiple attempts to commit suicide, difficulty in feeling empathy for others. People with borderline personality disorder may exhibit some or all of the symptoms mentioned. Before an individual can be diagnosed with borderline personality disorder, it will require a mental health professional to evaluate long-term patterns of functioning and symptoms. Before such diagnosis can be made, the individual's age should not be lower than 18 years. Because at that age, an individual's personality is believed to have been formed. Anyone below the age of 18 years cannot be diagnosed of any form of personality disorder. It is also important to note that a person may have more than one personality disorder. Don't be too quick to say you have borderline personality disorder, just based on the fact that you can relate to some or all of the symptoms mentioned. It's not a disorder that can be self-diagnosed. People with borderline can be difficult to manage because of the nature of their symptoms. They can be quick to open up to a therapist, and perhaps even quicker at shutting down. And while individuals with borderline personality disorder often crave approval, a small provocation can trigger abusive and even violent behavior toward those trying to help them. However, individuals with BPD can benefit from a combination of different treatments including psychotherapy, medication, psychiatric management, social support and self-care strategies. DBT, which is dialectic behavioral therapy, is usually effective in the management of borderline personality disorder. DBT helps the client manage emotions through teaching skills such as emotion regulation and mindfulness. Mindfulness can help the client to refocus from the need to seek instant relief through self-harming to observing and experiencing them through stillness. DBT is a type of cognitive behavioral therapy that teaches the patient how to think and behave in healthier and more productive ways. It helps clients to accept who they are and how they got there. Acceptance is taught through life skills and behavioral chains. Medications such as mood stabilizers and antidepressants could be helpful in managing borderline personality disorder. I'm sure you found this video educative. Thank you for watching and engaging our videos. If you're yet to subscribe, kindly do so. We look forward to expanding our community and ensuring that our mental health awareness campaign get to more people. Thank you all. Cheers.